Good evening, everyone, and sorry for that, what you call glitch. Our internet had just kind of vanished for a moment and then broke our live feed, but we will begin again for you because we want to concentrate all of this information in one discussion. So we've decided to start back from scratch. So, once again, good evening, and thank you for joining us here at Belize Medical Associates for this live and very important discussion with Dr. Victor Rosado, pediatrician with a master in public health and a member of the Ministry of Health's COVID advisory team. We are here today to talk to Dr. Rosado about COVID in children. And once again, we remind our audience and everyone tuning in live on Facebook that you can go ahead and submit your questions by making a comment under the live video post. And we will read them to the doctor, and he'll be answering them live during this discussion. So please feel free to go ahead and comment and ask your questions, and we will do our best to answer them tonight. With that said, our topic for tonight again is COVID in children. Good evening, Dr. Rosado.
Good evening, Richard.
Dr. Rosado, please tell us what is the concern with Omicron variant? What makes it so contagious, and why is it a concern for children?
So, Omicron variant, because of the changes that it has on the spike proteins, it makes it more contagious. Means you're easier to catch it. It spreads faster is another term that we use. So when with other variants, we would say one person who is positive can spread it to 1.5 or to 2.5 persons.
Mm-hmm.
With Omicron, it went up to 5 persons, sometimes 7 persons, because it is far more contagious. It was compared to being more contagious than measles, which was one of the most contagious viruses documented. So, and we've seen around the world, and in Belize, if you look at the graph, you see a first wave, then we saw a second wave during summer, and really for Omicron in most countries, it's not a wave, it's a straight wall. It goes straight up.
Yeah.
All right. So, and if you look at statistics for most countries, for the UK, for the US, for South Africa, where the first identified it, that's so it tells us, one, it is very, very contagious. There was a disconnect in terms of the number of infections and the number of hospitalizations and the number of deaths. And so with the other variants, the deaths would follow the infection. So if infections rose threefold, then the deaths would rise as well, like 2 or 3 weeks later. But what we saw with Omicron was the infections skyrocketed, but the deaths did not follow, which led us to believe that it was less virulent or less serious. The hospitalizations did not skyrocket, but they did increase, because if you have a huge number of persons getting infected, you will have certain vulnerable populations or high-risk groups that will end up in hospital. So we are seeing an increase in hospitalization.
Are you seeing an increase in hospitalization of children?
Not hospitalization of children, but we're seeing an increase in cases in children.
Right.
So they're not coming severely infected that we need to keep them in hospital, but they're coming now. Previously, for all the other variants and the entire course of the pandemic over the last 22 months, very few children were infected. Worldwide, you look at the statistics prior to Omicron, less than 12-year-olds were responsible for less than 0.1% of the deaths worldwide. And so that generally made us pediatricians especially feel like it was sparing our population. But Omicron changed that a bit, and we're definitely seeing more infections, not necessarily more hospitalizations or more deaths.
So this is a concern more for children, right? The Omicron variant still, because they are being affected now more than before, you said just now.
More than before, but still less than adults.
Still less than adults?
Yes, of
Yeah.
course, still less than adults.
So how is the Omicron variant affecting children then in particular? And what group of children are we talking about who are really, at risk for developing these kind of terrible symptoms?
So in Belize, the Omicron wave coincided with starting of schools, and so we have not really done all the analysis to see if that was a driver of infection. I don't think so, but we saw more children being affected definitely with this Omicron strain. We would see adults coming in and bringing their entire family, and the entire 3 children testing positive, the wife, then the aunt, then the sister. So the Omicron, once it got into a household, there was a very, very high possibility that everyone within that household would have tested positive eventually.
What about the vaccinations? Are there any, I know 2 things I want to ask about vaccination. One, do vaccinated children have lesser symptoms, or are they affected less by the Omicron variant or COVID in general? Is that a fact?
Definitely. So with vaccines, I think that we should start to stress that vaccines save lives. Statistics are, in most countries, we recently got some new statistics for Belize where you're comparing deaths between vaccinated and unvaccinated population. Over 600 deaths that we've had throughout the pandemic, and definitely there's a much higher percentage of deaths within the unvaccinated population, and so we need to stress vaccines save lives.
Yeah.
It does not guarantee that you won't get infected.
Right.
All right. So it does not stop infection, and so the people who are vaccine hesitant, or what we refer to as anti-vaxxers or so, would jump on that and say, see, the vaccine no good because you still get infected, but you're not dying. All right. So we need to look at the big picture here of the 600 and odd persons who died in Belize from COVID. The vast majority was unvaccinated. And the same would apply for children. When it comes to vaccine in children, in Belize we started vaccinating with the Pfizer vaccine children between 12 and 18 years old. All right. Initially we had a good uptake of those vaccines. They were done in schools. They got their second dose, and now they're eligible for boosters. But there is still a huge, maybe not huge, but a significant sector of that population, that group that was not enrolled in school, that we have yet to reach with vaccines between the 12 and 18-year-old age group. And then the other age group that most parents, when we talked about opening up schools, is the primary school age group, which was between 5 and 11-year-olds.
Yeah.
Unfortunately, the Ministry of Health and the government of Belize has not been able to procure that specific vaccine, and we the team advising the Ministry of Health have been advocating for that vaccine for some weeks now, and so Ministry is trying to procure that vaccine for that age group. It's not easy because it's the newest vaccine, so the US is not donating it to countries. Countries are paying cash money for it, and so that's unfortunately that is one of the realities of this pandemic. So we are trying. When we are going to get it, I am unable to say, but we are definitely trying to get that vaccine for that age group.
So so basically in the meantime, kids from the age of everyone under 12 years old who cannot get vaccinated right now, they are basically unvaccinated. That's a reality, right?
Yeah, they're unvaccinated. Fortunately, they're not high risk. Fortunately, they're not a high risk group. What we can do in our family is to make sure that everybody else is vaccinated. So everybody else 12 and above, brothers and sisters, parents, grandparents, if they are all vaccinated and the child gets it at school, then when you reach home, the virus will not have fertile ground to spread. And if somebody gets it, more than likely it will be controlled. It won't, because we said that persons who are vaccinated and boosted have a much better chance of dealing with the virus.
Right. We had a question here, Doc. I'd like to read it. And the question is, what is the after effects of a child that has had COVID, and can anxiety affect them? I guess.
I think anxiety, from the time we started talking about pandemic, we saw anxiety in children. We took them out of school. We told them they could not go to the playground. We told them they can't play with their friends. They can't go visit their grandparents. And so that is definitely a formula for anxiety in children. Added on to that, if the child was infected, God forbid, hospitalized in an area where visitation was restricted, definitely it's easy to see why that patient would have anxiety and definitely would need help from a professional in mental health.
The question, the second part of that question was about after effects in COVID, and you know, in your experience, what are the organs that are most affected by people who have had COVID? Is there a kind of long-term?
Mostly affected, it is still primarily respiratory system. So we have much more studies in adults. Okay, so mostly you stay with certain short of breath, but it's systemic as well. So people have fatigue, weakness. They say, Doc, I just don't feel the energy. There's a thing that they refer to as brain fog, where people feel like they just know they think correct. And then you have the isolated or the not so common side effects. People have developed skin conditions. People have developed diabetes secondary to COVID because it affects the cells in your pancreas that produce the insulin. You have the central nervous system infections, meningitis. You have Guillain-Barré. So it can affect most organs in your body.
I understand with the Omicron variant, there is a condition called a croup. No? Is it a croup? That's what it's called?
Yes.
A kind of like a dog cough, something of that nature that affects the larynx?
Well, when the Omicron appeared in December, mid-December last year and towards the end of the year, that coincided with what we refer to as croup season, because it's cold front in Belize and even in the US, basically croup is what we refer to in Belize as dog cough.
Mm-hmm.
It's an inflammation of the airways near the vocal cords, and so the cough sounds like a barky type of cough. And these patients, when they came in to the hospital and we would swab them, we would find that it's COVID positive. So rather than the traditional virus causing croup, it was the COVID virus causing it. The treatment is the same as traditional croup, nebulizing with steroids to improve the inflammation of their airways.
So, with regards to babies, because they are at risk with Omicron now, right? Would you say?
Yes.
How about with pregnancy? I remember there was some hesitation with pregnant women receiving the vaccine. I think they weren't sure if they should be vaccinated. Can you update me on that?
Yes, so most vaccines, like medications, the trials would not include pregnant women initially.
Okay.
So trials of new medicines and vaccines would be what we refer to as consenting adults. And that's how the vaccines were developed. First for adults, when they saw that they were very effective, minor side effects, then they started trials on pregnant women and children. And so from adults, then the vaccines were approved for pregnant women, and then vaccines were approved for children between 12 and 17. Now they have been approved for 5 to 11, and it's quite possible that we get vaccines from 1 year or 1 year to 5 year old in the next month or two.
Should COVID positive woman breastfeed? I mean, is there any chance of transmissibility by doing so?
She should breastfeed. She should breastfeed. We'll test the baby. If the baby is negative, she should still breastfeed, but with a mask on. So she would transmit the virus to her baby through the normal way, through her breathing and droplets from her airways, not through the breast milk.
Yeah. Okay, good. Let's ask these two questions here that were submitted. I think you answered this first one, but we'll just go ahead and read it. The question is, do you know more or less when the vaccine for 12 and younger will be available?
Yeah, unfortunately that's not a question I can answer. I think I said that our government is actively trying to procure this vaccine.
All right. I see we have some general questions here. This question that just came in is asking, is ivermectin good for an asthmatic person?
I think no, we should not be recommending ivermectin. We have much better drugs to treat COVID than ivermectin.
So the concern with people with asthma and COVID, what advice can you give them?
They are considered a high risk, and then definitely they should use the more accepted inhaled steroids. And now for the mild to moderate cases that are not hospitalized, we do have treatment for them. We do have an antiviral known as molnupiravir, which would definitely reduce hospitalization and improve outcome. So I think the time for ivermectin has elapsed.
Okay, good. And that, can you repeat the name of that medication once again?
The oral pill that they talk about, there were two on the market, one from Merck and one from Pfizer. We in Belize have the one from Merck.
Okay.
The name is molnupiravir.
That's the red one?
I don't know.
There's a red pill.
I don't know if it's the red pill or what.
Yeah. Well,
that's available in Belize.
Okay, we have the option. Excellent. Okay, Doc. one more question here. And guys, please keep asking the doctor your questions. Feel free to do so. That's why we're here. That's why we're having this live discussion. It gives you an opportunity to interact. And if there's something on your mind that you need to know, you don't have to schedule a consultation. You can actually ask us right now. The next question here we have is, what would be the signs of anxiety in a child after COVID? How long more or less would the anxiety episodes last? That's a very difficult question.
Yes, because a lot of things with COVID hasn't been fully established or studied yet. Okay.
Yeah.
So COVID is a new disease, and traditionally we in the medical community, we know about things from reading books, but with COVID there are no books on COVID. We need to be reading journals, and we need to be reading articles online every single night. And things are changing with COVID. We have a new variant. Everything changes again once a new variant comes out. And so to answer that parent's concern, a child needs to be supported. Anxiety will not come just from the infection, but from everything that surrounds the pandemic. There has been a change in our lifestyle, and there's been a significant change, I think much more so in children's lifestyle, and that is why I'm a strong advocate for going back to school. I think that the kids being out of school for 2 years is unprecedented. Never did we believe that we would yank our kids out of school for 2 years.
Yeah.
And so the effects of that can definitely cause mental health disorders. So we it's not just COVID per se.
So you advocate kids returning to school?
Yes, returning to school with precautions. So it's not just a blanket return to school. I think in 2 years we've learned a lot. We know that hand washing, mask wearing, social distancing, and when it comes to school, proper ventilation, those methods and those measures play a significant role. And we're not talking about buying super expensive equipment. So once these can be put in place, a screening that if the child has symptoms, have runny nose, have fever, they stay away from school. So we can definitely do that and get our kids back in school.
Well, you mentioned something about the possibility of a new variant coming along, right? Is that likely, and could that be potentially a deadly possibility? Could it actually go, because we had this kind of downgrade in a sense of the Omicron, where Delta was much more lethal, killing much more people, and now people find that with Omicron there's less hospitalizations, as you said. Is it possible for the new variant? I'm not trying to inject any fear here. I just want to know, is it possible that a subsequent variant could be more lethal? Is that possible?
Possible, of course. Possible. Maybe even likely.
Really?
Yes. You see, the variants will keep popping up once there is a fertile population for the virus to spread. Every time, every new person that the virus infects, and there is replication of virus 1,000,000 times in a person. There are populations in certain parts of the world that have less than 10% of their population vaccinated.
Yeah.
And so once we have that fertile population for the virus to spread, it's very likely that we're going to get new variants. If they will be more lethal, if they will be more virulent, that's a guessing game.
So, but the variants, are you saying that basically they're they're into existence mostly from the virus infecting unvaccinated people. Is that what you're saying? Or
Well,
can it just happen to anyone?
no, mostly the unvaccinated. So
Mhm.
when you have a mass, like in certain countries where, if you see the map of let's say African countries
Mhm.
that have had very little success in vaccinating their children for various different reasons,
Mhm.
that's where variants will pop up, all right, because there is so much viral replication that with each replication there is a potential for new variants, and we're having variants almost, I would say, on a weekly basis, just that they're not variants of concern. So
Mm-hmm. I've heard, and I could be wrong, that people who have caught the Omicron variant may be better protected against these future variants as well. Does that just have to do with the immune system response?
but again, that's not substantiated. We
Okay.
don't know, we can't project that because we don't know what the new variant will bring along. So
Yeah.
remember, what the virus is trying to do is the virus is trying to survive.
Mm-hmm.
And so new variants will become, they're trying to outdo either your immune system or outdo the vaccine. So that's the challenge. We're producing antibodies, we're vaccinating our people. The virus wants to keep on living, and so when it replicates to a point where it can outsmart your immune system, that one will thrive. And like I said, you give the virus that opportunity if you have large swaths of population that are unvaccinated. And unfortunately, if you look at the statistics in the world, there are still countries that are yet to vaccinate. WHO had put a target of 40% of their population. Some countries are still below 10%, and so that's definitely a concern. So a lot of people are tired of COVID.
Yeah.
A lot of people want the Omicron to be the last variant. They want to go back to going out at night and having no curfews.
Yeah.
But but you being tired plays no role with the virus.
Yeah.
And I think one of Fauci's famous line was, "The virus dictates the timeline, we do not dictate the timeline." So
Yet there is something we can do about it though, and that is to get vaccinated.
we need to push vaccines.
Yeah.
Even in Belize, we've done very good in Belize.
Mm-hmm.
If you look at our statistics compared to regional countries, Belize has done a great job.
Mm-hmm.
But somehow we stalled around that 50%. We came into like November, and since November it has been very difficult to move the dial much far beyond the 50%.
I
We're
think.
getting into a population that's hesitant,
Yeah.
a population that's harder to reach. But for us to have a certain level of comfort and to say, well, we will get rid of the curfew soon, or we will stop wearing masks, I will tell you, we need to reach at least 70% of the population vaccinated.
And a lot of people I know are looking at these reports that the ministry puts out with the hospitalizations and the people who have died, and they're saying, well, look at this large group of people that are been fully vaccinated that have passed away, but those cases are unique. I mean, those people could have had underlying conditions. I mean, we don't really know, right? Is that, I mean, because the fact is that the vaccines will protect you. And it's not a guarantee, if depending on your individual, health profile, that it will save your life. No, but it is definitely something. What do you think about that?
So with statistics, you cannot use 1 or 2 days. So let's say we produce daily statistics on the news, and yesterday, if there were 4 deaths in Kalyushna and 2 were vaccinated and 1 was unvaccinated, then people jump on that and say, so why would I get vaccinated?
Exactly.
Because 66% of the deaths are vaccinated.
Yeah.
That's wrong. We need to look at big picture. So of the 600 deaths that we've had in our country, when we compile them, almost 70% were unvaccinated. And so there is overwhelming evidence that vaccination works. Vaccination prevents lives worldwide, in the US and in Belize.
Yeah.
If you look at the compilation of data over a long period of time, vaccination saves lives, vaccination prevents hospitalizations. All right.
Jumping back to the topic of schools reopening, I have a question. This is kind of like there's two parts to this question. One, when would it be safe for a child with COVID to return to school? For example, let's say school is reopening and this young man or young woman has caught COVID, right? And in their home they have outbreak, and school is 1 week away. How can that person be certain if their symptoms have subsided sufficiently that they feel well, that they are not in a position to transmit the disease, to spread it? Like, how can how can they be sure? What do you recommend that they do?
So for most, not only for children, we know that your symptoms last 5 days, 7 days. Initially it was 14 days. We were quarantining people for 14 days. We saw that was not necessary. The US cut it down to 10 days, and then they've cut it down to 7, and now even to 5 days. You have to ask yourself, is the person still infectious? Is the person can still transmit the disease? And there are studies that show that if you have no symptoms after 5 days, it's very unlikely that you're transmitting the disease.
Okay.
You will transmit the disease when you have your symptoms, when you got your runny nose, when you got your cough, when you got your fever. 48 hours after that, if that coincides with day 7, then the likelihood of you transmitting the disease is very, very small.
Okay.
And that is why ministry has taken the position that for certain essential workers, you can return to work at day 7, and for other workers at day 10. We now believe that 14 days is not necessary.
Okay.
It's all based on, can you keep on transmitting the disease?
Right. But each person may vary with that, right? I mean, someone who might be kind of have allergies, or perhaps they have this lingering cough or something like that. Right? I know a lot of people who would have like a lingering cough. They would still be coughing a little bit here and there, right? It's not the major cough, but it's something, and something coming out from the lungs. I mean, what's the surest way if you to be, absolutely certain that you're going back to school, you don't have this thing, you're not going to go spread it to your classmates or something like that? Is there's a test available?
You use the same rapid test.
Okay.
You use the same rapid test, and if you test negative, then that gives you a certain level of reassurance.
Yeah. So you think that would be an option then, perhaps?
For those cases, yes. But for the majority, we're not advocating that everybody needs a negative test after day 7. If your symptoms have disappeared and you feel good, then you can reintegrate back into society.
Safely, you would say. Okay. How about when, transmission through food? Can you catch COVID from buying food off the street, or, maybe buying at the cafeteria at school, if that's open?
Very, very unlikely. In the initial phases of the pandemic, people were washing their vegetables in Clorox and spraying their grocery bags with Clorox, and
I still do that.
the studies after 1 year showed that chances of getting COVID from what we call fomites was very, very small. It's far more from person to person contact.
Now, a question I have here again about the difference between Omicron and Delta. We believe now that Omicron is kind of largely the variant responsible for people getting COVID at this time, right?
Yes.
What has happened to Delta? And when I ask that question, I mean, if you catch COVID today and you're concerned about which variant do you have, is it possible to, by your symptoms, detect whether you have Omicron or you have the Delta that remains around?
So what happens is that the virus cannot live on its own. The virus needs a host. The virus needs people to go from within that 7 days to jump to another person to keep on spreading.
Right. Chain reaction.
When you get a more contagious virus like Omicron, they take over.
Okay.
They take over, and so they are spreading faster. They will catch the inhabitants at a quicker rate. And so what happens to Delta is that
Lose the
she's
competition.
losing the race. Yes.
Yeah.
So they will still have 5%, 10% Delta around.
Okay.
It doesn't disappear, but Omicron is spreading much faster, and so the predominant strain becomes Omicron. If it is necessary to find out which strain you have, I don't think it's practical, nor is it necessary from a clinical point of view.
Okay.
Even in the US, they won't tell you have COVID this strain, because to what we call gene sequencing is a very drawn out process. It takes the least few days. In Belize, we're down to 2 weeks for them to tell you which strain you have.
By the
And
time
so
that you don't get better, or
yeah, but like I said, it doesn't make a big difference.
Okay.
It's just for us who are studying the pandemic and the trends to be able to know. But for the individual, it doesn't make a big difference. We're treating, we don't have a specific treatment for Omicron versus one for Delta versus one for Alpha.
okay. So, can you, to summarize what we've talked about tonight, I think just to ask a very clear question, someone is concerned that they have contracted the virus. What are the typical symptoms?
So it seems like a very straightforward question. However, what we've learned over the last year is that there are no typical symptoms. It can be people come in with an ear infection, and we test them, they have COVID. People come in for an appendicitis, and we have as a policy that if you're going to operating theatre, you need to get tested. Maybe it's not, COVID did not cause the appendicitis and you have concomitant infections, but COVID is so widespread, so rampant, that we need to always be thinking of COVID when you seek your medical services. And so that is why most hospitals have set up screening protocols where you need to get your temperature checked. You need to have a questionnaire where they're asking you for the typical symptoms, which would be cough, cold, runny nose, that sort of thing.
Yeah.
In children and Omicron now, we're seeing much more gastrointestinal problems, diarrhea, that sort of thing.
Okay. So a variety of different
variety of
symptoms,
and
yeah.
signs, yes.
Because I know a lot of people who I have known who have caught COVID, there's a lingering moment there where they're wondering, do I have it? should I get tested? These are my symptoms. They don't seem like COVID. I mean, people want to always hope for the best, no? They say, I just have congestion. And they end up being COVID.
Yes.
Somebody else would say, hey, I have a bad cough and fever. I say, oh, you sound like I got COVID. It's
of
just
course, everybody wants it not to be COVID. So some people would say, they're not COVID, they're flu. But there's no way to know unless you get tested.
Yeah. Here's another question that I think there's so many questions with how COVID affects you, and this one goes straight in line with that thought. The person asks, vertigo, unbalanced, difficult times, walking and doing basic work, finding yourself falling down, even blacking out. Are these signs of, I suppose, post-COVID symptoms or?
Well, if the person had COVID and had moderate to severe symptoms, those would definitely be signs of what we call central nervous system involvement. And yes, I am sure that there will be cases with those signs of sequelae from COVID, and you should see your neurologist,
right,
if you have those signs and symptoms after COVID.
Mm-hmm. So no matter what you feel like you have remained with as far as the symptoms thereafter, after you've recovered from COVID, you're saying basically that at that point you should just check your doctor.
You should check because I said before, with COVID, nothing is for sure. COVID is a new virus. We're 2 years into this pandemic. We still have not written the final chapter with COVID.
Right.
And so asking what is specifically the after effects of COVID, it's very hard to box it into a list of signs and symptoms. We're still getting new, and with variants that have yet to come, we still don't know yet.
Yeah. Wow. Dr. Asado, in closing, what points would you like to highlight for the public in summary, things that they should know, just some very important points that they can take away from this discussion finally?
So in summary, we're all tired of COVID, but COVID seems to be not tired of us yet.
Yeah.
Right?
Yeah.
So the pandemic is not over. The
Mm-hmm.
pandemic is not over. We cannot let our guards down.
Mm-hmm.
We need to take advantage of the knowledge that we've gained over the last 2 years. I know we're tired of mask wearing, but for some of us who have to wear the mask almost our entire day, we have to suck it up and use the mask. We need to still be careful. I want to advocate for continuing to push vaccines. If you have not yet been vaccinated, you have seen that across the world there have been billions of doses of vaccines that have been administered, and the side effects, the serious side effects, have been very minimal. So if you were sitting on the fence saying, I want to see if they will turn into iguana and alligator and that sort of thing, that has not happened. Alright, and so I think that the vaccines are safe. You should get vaccinated. And finally, when it comes to kids and school,
Mm-hmm.
I am a big advocate for sending the kids back to school. Check with your school, make sure your school have the protocols in place.
Mm-hmm.
And if there is an infection in the school, then maybe that classroom needs to close down, but not the entire school. We need to really push for our kids to get back to school.
Yeah.
I've seen kids who, for 1 year in the pandemic, gained 40 pounds because of just staying home and playing video games and not getting enough physical activity.
It's so true.
And so the ramifications, like I said, have not been documented, but the ramifications in children, I believe, will be, if not as severe, maybe even more severe if you add in the mental health issues that our children will suffer from this pandemic.
Yeah, I think that is actually probably the greatest consequence of it all with COVID, since the kids are doing better overall, the virus not getting it and getting well. I think that is the difficult thing. If you ask any child in this time, what is the hardest thing about the pandemic, they'll probably say not seeing their friends, not going to school, and just kind of being isolated, I suppose.
Yes.
And another question comes to mind. Sorry to have you here for one more, but I know people who have not been vaccinated, right? These are real situations, and they contracted the virus, recovered from it. Your advice to people like that who are still on the fence about vaccination, should they, even though they've caught it, should they go ahead and get vaccinated?
Yes, they should get vaccinated because new variants are coming. We know that your immunity, your antibodies wane after 4 to 6 months.
Okay.
And so you should definitely get vaccinated.
And tell me about the booster quickly. What is the importance of that? Someone's been vaccinated, you said they have a window of protection 4 to 6 months. That time has expired. Let's say someone got the 2 vaccines, didn't get the vaccination for 7 months. What do you recommend?
You need to get boosted.
Okay.
So when we vaccinate children, you can recall this, we do it 2, 4 and 6 months. Almost all of the children vaccines have 3 doses.
Okay.
So it's how basically your immune system work. We need to, in small doses, provide the antigen. Your body develops antibodies, and it's over a series of shots which we that you can develop a certain level of antibody to give you upwards of 90% protection, which is what you would need to feel secure. So for like hepatitis B, you need to get 3 vaccines. I have yet to see parents who say, "Doc, I don't want 3 and I only want 2 and it." Doesn't make any sense. And so now I think it was a marketing problem to say that it was 2 vaccines and now you need a booster. I think in hindsight it should have been marketed or sold as 3 doses.
Good. Dr. Rosado, thank you very much.
You're welcome.
It was very valuable information that we took away from this discussion tonight, and I hope it has been helpful to everyone who sees the video.
Thank you, Richard.
Thank you.
Thank you.